The health authorities have begun fogging operations at Tar in Bastora village after 17 cases of chikungunya have been confirmed by the health authorities, which has created panic among the locals.
Around 26 locals from the Tar Bastora have complained of fever and joint pain, which are the symptoms of chikungunya. Of the 26 blood samples, all from the Tar Bastora area, tested at the microbiology department of Goa Medical College and Hospital, 17 tested positive for chikungunya, confirmed the health officials at the primary health center at Aldona. Officials from the Department of Health Services are carrying out a house-to-house survey to determine if there is any more unreported cases of chikungunya.
घाण जाल्ली आहा आनी ताका लागून जळारी खूब जाल्यात आमकां दिसाचे रातचे जळारी खातात ह्या दिनान बसल्यारूय जळारी खातात नातवाक येयला म्हाज्या जोर ताच्या मनशान येवन तिगांयचे आमचे रगत काडला आनी हेला काडून.
Speaking to Goa 365, the health officer at the primary health center at Aldona gave details of the current scenario at Bastora and requested people to take precautions.
Bastora village, which is under primary health center Aldona, the total fever cases which we counted for the period from 15 days period from 8th of this month till today.
The drying so that there will be a control on chikungunya cases. This is observed by me for the now only, so I had instructed my Talati to call the party who is doing all these illegalities so that action could be taken against him. We have to check whether there any permission have been sought by him for doing all this. Otherwise, course of action will be taken as per the law.
Was 26 total fever cases. Out of these, 17, I should say, they are clinically diagnosed as chikungunya on the basis of the symptoms. Mainly, these 17 cases had associated joint pains, severe joint pains, and they were fitting in the clinical picture of chikungunya. At present, although we have not received the blood sample report, we are accepting that this is clinically diagnosed as chikungunya cases, 17 of them, 17. Again, out of these 26, one patient we got is Vivax malaria. It shows that the malaria is also, cases are coming up there. And again, 8 cases which are remaining are of other fever cases, which neither fit in chikungunya syndrome nor in malaria, which could be said that it is other fever cases. So, under this situation, what weapon we have, effective weapon for control of the chikungunya cases is mainly the source reduction. Source reduction means mosquito vector which is in the area which is transmitting the chikungunya virus from person to person. We have to control.
Speaking to Goa 365, the Sarpanch of Bastora said that the outbreak was due to the water stagnation in the area. He also informed that the Panchayat has already approached the water resources to take up the cleanliness.
So regarding that chikungunya in Bastora, so आमचो एक मेजर प्रॉब्लम आसलो की आमी लास्ट टाइम ते डिसिल्टिंग केलेले सराउंडिंग एरिया प्लस तेचे थ्रू वॉटर रिसोर्सेस एंड वी हैव कॉन्क्रीटेड द साइड वॉल. So now the main problem is that from the other part the water is not coming this side. So it is a problem and water gets stagnant. So from the bridge next like 5 meters the cross drainage it is come down. So that's why the water drain cannot work. So we have made a letter to PW and the PW already has tendered the work. Only we are waiting for the collector permission to close the road and to take the work for 45 days. Which I think the problem will solve because there will be no water stagnant. That is the main thing. If once it is done, then I don't think that these malaria cases will be there in Bastora. So we have informed the health officer and the health officer has already given one awareness talk also to them. And plus evening daily they have started that fogging thing for the mosquito.
The increase in the number of chikungunya cases at Bastora has also worried officials of the Mapsa Urban Health Center. Taking all the possible preventive steps, the teams have been sent to the affected areas. Other precautionary measures have also been taken by the Mapsa Urban Health Center.
In these cases, there are 20 suspected cases, but proved cases are 3. That's what report has come from Goa Medical College. If there are any new cases, fever cases with joint pains, joint swellings, samples will be taken and they will be sent to Goa Medical College. But at present in Mapsa, particularly Gamsawada, there are no reported cases. Still, as a precautionary measure, we are going to do cleanliness drive today itself with all my staff who is present over here. This is with cooperation with Deputy Collector of Mapsa as well as the councillor of this area, Srimati Chitra Manerkar. Nala, it is a saline water, but due to stagnation and innumerable bamboo pieces, there is a typical bad smell in the area, and all these conditions are totally unhygienic.
As the main accused of the outbreak of chikungunya is supposed to be the Nala at Tar Bastora, the Deputy Collector of Bardes has directed the Talati of the Bastora village panchayat to send the report.
The present inspection is being carried out as per the instructions and a request of Dr. Pratima Thali from APSA. This inspection is being carried out just to check because of chikungunya cases reported in this particular area. Though this particular portion where we are standing is coming under within the jurisdiction of PSC Aldona, but we have taken an initiative because more cases have been detected here, and since the municipal area just start across, we were taking a preventive measure so that the chikungunya cases, this disease does not spread on the other side. That is why we have started here the drive so that there will be a control on chikungunya cases. This is observed by me for the now only, so I have instructed my Talati to call the party who is doing all these illegalities so that action could be taken against him. We have to check whether there any permission have been sought by him for doing all this. Otherwise, course of action will be taken as per the law.